my name is Kelsey, and today I'm going to be going over a diagnostic procedure called a colposcopy. A colposcopy is essentially a test and procedure that allows for a more in-depth examination and analysis of the patient's cervix, vagina, and vulva. Since this procedure allows for a more closer examination, this test is typically recommended if a female were to have a abnormal result on their pap smear, pap test. So how is the test done? So the test is completed very similar to how a pap test would be done in regards to positioning. You'll start off lying on your back with your feet in stirrups and or supports, and your doctor would then place the speculum into the vagina, followed by the colposcoscope to aid in the visualization. This instrument kind of works like binoculars and will let them get a better visual, again, of what they're looking at. So with this, they'll then swab any areas that they might need. They will perform any other additional tests and procedures. These might include doing an acid wash, as well as using color filters on the colposcoscope, as well as then take any tissue samples of concern, and then those would then be sent to the lab for analysis. This procedure can help diagnose various abnormalities. Some of these can include genital warts, cervicitis, which is also known as the inflammation of the cervix, as well as any precancerous changes of the cervix, vagina, or vulva tissues. The test itself is fairly quick. It can take anywhere from 10 to 20 minutes. Now, as the role of a hospital unit clerk, what kind of things would that entail? So one of the questions is, what diagnostic imaging department would the hospital unit clerk need to contact in order to book this assigned procedure/test? So from my research, this particular procedure, I don't believe you would necessarily need to contact really any diagnostic imaging departments, as no imaging like CT, X-ray, MRI machines are used. Essentially, any medical provider with the specialized training can perform this type of procedure, such as an MD, a nurse practitioner, a physician's assistant, or even a midwife. Diagnostic imaging, any kind of, or other procedures, you will need a requisition. So completing and sending the appropriate requisitions, such as one could be a microbiology laboratory requisition, as well as potentially completing a request for consultation, that being said, only if instructed by the doctor's order sheet and if potentially not already done. And this would be sent to the OBGYN department, as well as potentially booking the procedure. And you could also help out the other coworkers by completing and preparing patient labels with paper clips, elastics for the application of any specimens taken. Another thing you might want to do is, if the procedure is needed, getting a consent form ready for the said nurse or doctor to go over and to get the patient to sign. As well as other additional tasks potentially would be to arrange for patient transportation if they're going to be needing to travel to a different area of the hospital, different department of the hospital to get the procedure completed. Or you might need to complete potentially a special order request if you would need to get the instrument, the colposcoscope, sent up to your unit, if it's not already there, which, depending on which unit you're working on, it probably wouldn't be. And finally, what other departments would the hospital unit clerk need to be in contact with in order to complete the additional tasks? So with that, again, a department you might need to be, or you might already be in contact with, is the OBGYN department, as well as be in contact with the laboratory. So To analyze these types of tissues and samples, you would probably be involved in sending requisitions, sending specimens to the pathology and microbiology departments within the lab. Okay, so basically this test will allow your physicians, will allow other people, other parties need on your care team involved to get a better idea of what might be going on down there. It can allow for that kind of pre-screening, which allows for that preventative measure. It's a relatively simple, quick procedure that can get done, but that can give the physicians and care team a whole load of information on what might be going on, if anything. Another thing to note too is you may need to repeat the test a second time, just like you might need to repeat a pap test a second time if you get any abnormal results or normal results. That would kind of be dependent upon who is looking after you in that regard. So again, I find it's a really cool test. It's really quick, more or less relatively simple, generally painless. Again, kind of similar idea with the pap test, maybe some cramping, some mild pain, that kind of thing. But definitely something really cool that we can do to use as a preventative measure.